Good morning and welcome to the Point. It has been another remarkable week here in the state of Michigan. Seemingly almost every day there is another new rule or regulation that disrupts our lives because of the coronavirus. This week, no exception. The closure of schools for the rest of the year. We talked with Governor Gretchen Whitmer after she made that decision about how that will impact school districts and the state. Let me ask about your effort to expand this emergency situation in the state for another 70 days. The Senate Majority Leader and some Republicans have not warmed up to that idea. They're coming back to town on Tuesday. Are you negotiating with them, and where are we with that proposed expansion?
Yeah, we have an open dialogue. We've worked really quite well together during this emergency. I am grateful for their leadership. You know, expanding the scope of the emergency to 70 days gives us the ability to do a number of things. One is to ensure that we are protecting liability for our frontline medical professionals. Going piecemeal and doing a renewal for every couple of weeks, I think, unnecessarily keeps bringing the legislature into town to a place where they have to congregate, puts them back on the road and the gas stations outside of the home. It flies in direct contravention of what all of the scientists and best medical counsel is giving us, which is we need to limit that. That's precisely why we have the stay-at-home order. So I still am hopeful that they will consider doing a 70-day extension so that we can keep doing the important work of running state government without unduly exposing people to COVID-19. And let's remember, when the legislature comes in, they come in from all parts of our state. They congregate, and even if it's a few people in a room at a time, they're still congregating unnecessarily, and then they go back to their communities. And so this is precisely how things spread exponentially. I believe that they're going to take a lot of precautions, but I still think that the best thing we can do is say we're going to be confronting this for at least 70 days. It doesn't mean the stay-home order is in effect for 70 days. It doesn't mean all the other orders I've issued are lengthened by that same time. It simply means that we recognize we are going to be in a state emergency for at least another 70 days, and that's precisely what all the epidemiologists and doctors are telling us, and that's what the experience has been around the world.
The violation for not staying at home or violating the stay-at-home order has gone from $500 to $1,000. Does that signal that you're going to look to law enforcement for stricter enforcement of that stay-at-home order? Because up to now, a lot of law enforcement agencies that we've talked to have said, look, we're not going to go out and immediately write tickets. We're just going to have conversations with folks. But is it coming to that?
Well, I think first, and let me start with this. Michiganders are by and large taking this very seriously, and that is a good thing. If you look in the New York Times, I think it was yesterday, they have a map of where travel has really been cut the most. And Michigan is one of the best states on the map, to be honest, since I introduced the stay-home order. People have really, by and large, followed it. Now, does it mean that everyone is doing what they should be doing? No, it doesn't. Unfortunately, that's the case, and that's precisely why businesses that are not doing the right thing, or individuals who are not, will face some consequences. This is not a suggestion. This is an order, and this is about our healthcare system. This is about the health of everyone in the state. You know, COVID-19 can look very different in members of the same household. A member of a household can come down with what seemed to be kind of a mild cold symptoms and be carrying COVID-19 and exposing everyone in the house. The next person, the husband of that member, might have fatal consequences as a result of COVID-19. And so it's important that we all take this incredibly seriously. Michigan is now in third or fourth place, depending on the time of day and when reporting comes in, for COVID-19 known cases, as well as the death from COVID-19. And so we have to take this seriously. It's growing exponentially in Michigan, and a fine is one of the components of how we're going to be able to ensure people comply.
One of the necessary steps that you said you needed to take was having us all work from home or go home, closing down some businesses simply to prevent the spread. The outcropping of that was a surge on unemployment claims, and I know you've been asked this a number of times. Let me ask you this. Have you and your team come up with a way or is there a way to help make that process go more smoothly? Because you see a lot of people with a lot of angst because they can't get through to the unemployment agency, and it's through no fault of the unemployment agency, it's just this surge.
Yeah, our system was not built to handle a 4,000% increase, which is what it is. That's just a fact. And so it's not an excuse, it's a fact, and that's why I want to share it with folks so that they understand precisely what some of the struggles are that we're confronting. You can go online and file an unemployment claim. I've made it easier than ever for people to do that. We don't require the paperwork that used to be required. We don't have the same strict timelines that used to be applicable because we recognize this is going to be hard for everyone to check in, and so that to make it a little bit easier and to lift the burden on people, we did that. I've also extended the amount of time that unemployment people can be eligible for it. It used to be 20 weeks. I extended it to 26, and because of the actions of Gary Peters and our congressional delegation, we now can get up to 39 weeks. That's going to be a huge help for unemployed Michiganders. And so my message to people is, to be patient, to know that your claim will get filled, that you will not be penalized for timeliness or paperwork. Just be patient, go online. There is the queuing system so that you can get your claim in, and just grit your teeth. We're going to get through this together.
Governor, quickly, 45 seconds left. The elections in May could serve to bring a lot of people to polling places. I know absentee votes are going to be possible out there. Is there any suggestion, any thought about postponing that election?
I don't think we should postpone the election, but I am contemplating making it a vote by mail election. I'm talking with the Secretary of State. I am talking with Dr. Caldoun and the best scientists out there to make sure that however we design our ability to participate in our democracy, that it's done so observing the best practices for people's health.
The response to the coronavirus outbreak is not just at the state level. At the federal level, a $2 trillion stimulus plan was passed, and we talked with Lakeshore Congressman Bill Huizenga about that bill, about other action he would like to see taken, and what could happen in the future when more money is needed to fight the coronavirus. Congressman, the first thing I wanted to talk about was last week's bill that was passed, $2 trillion in stimulus to try to help during this time. Talk to me a little bit about what's included in there. Obviously, there are some concerns that some of the things included may not go directly to coronavirus, but nonetheless, speak to that bill last week.
Yeah, well, first of all, Rick, yes, there's a lot of money, but I had some criteria here that as I was looking at it, first and foremost, we knew that there needed to be immediate help to hardworking taxpayers, everyday Americans that suddenly found themselves in a very different situation than they had ever dreamed that they would be in. So that was accomplished by doing some direct payments to them. Having those payments going out here in the next couple of weeks is vital. Also, in the Phase 2 bill that we had passed a couple of weeks ago, there was that extension of Family Medical Leave Act as well as sick leave, and some of those things really targeted towards those smaller businesses. And speaking of smaller businesses, that was my second criteria. How did we make sure that small businesses that oftentimes are struggling month to month to make sure that they're covering payroll and rent and all those things, and by the way, it's usually those small business owners are the last ones to receive a check, that they were going to be able to have options and to be able to take care of their employees. That was accomplished in a couple of different ways. First and foremost, there is a tax credit for those that are going to continue to keep people on the payroll. That would be one option. The other option is if you are shut down and not able to work, those non-essential businesses that have been deemed by the state, for example, being able to go and get a quick, simple loan. It'll be administered by the SBA, but through our local lending institutions or banks and credit unions, being able to make sure that the cash was put into these small businesses with an incentive to retain those employees. to make sure that those employees had a paycheck, whether they were working or not able to work. So that 8-week period, once that application is put in, is actually going to be footed by the federal government. You can also roll in your utilities and your rent into that. So that was helping to try to take care of those small business owners and obviously subsequently their employees. And then the third thing was just the overall health of the economy. How do we make sure that housing mortgages are still available, car loans are still available, and we just don't have a general economic collapse like what happened in 2008? Very different circumstances back then, where literally illegal activities created a house of cards that fell. This is a voluntary shutdown of our economy because of this virus.
And we know this is going to have a long-term effect on the economy. Obviously, part of what you and your colleagues did last week was try to soften that blow as much as possible. But going forward, you have some more ideas about how to protect some of those people on the front lines. You are going to introduce legislation that would help some of those people. Explain what it is and who it would help.
Yeah, we call it the HEROES Act of 2020. And the idea is to give a little bonus to those people on the front lines, the first responders, police and fire and EMTs, the nurses, the physician's assistants, the doctors that are on the front lines right now trying to help deal with this. And here's what we paralleled it on. So when we send a soldier into combat, we suspend their federal income tax. They don't have to pay federal income tax for that period of time. I want to do the exact same thing for these first responders and these nurses and doctors that are helping us manage through this. And it doesn't cost an employer anymore. It would just be the federal government saying, you know what, you're on the front lines. We're going to treat you like you're on the front lines, and we're going to suspend your necessity to send in those federal income taxes. And we want to do that from February 15 and do it for a 3-month period, and we'll reassess. But that way, you know what? These men and women that are literally putting themselves in harm's way will have some reward for that, financial reward. And we know that's not enough, but that's at least a good step.
And finally, Congressman, we know that last week was a big step, $2 trillion. That's real money you're talking about. But there's already concern that there may be more need from the federal government. Are you in Washington able and have the wherewithal, have the reserves, or the ability to move money around if more money is needed in this fight that is expected to go on for likely months?
Well, Rick, certainly there are some things that can be done through executive power and executive orders. The Stafford Act, the different tools like that allow the president and the departments to move some of that money around. There may be a need for some additional resources. We have put a lot of money into I think, which are very necessary resources. There was certainly some things that were unnecessary in there that were not related to the COVID situation. I just hope as we look at the potential necessity for an additional bill that we really go in and are really sharpen the pencil and try to make sure that this is targeted and effective funding, and it isn't just throw money at the situation and hope it gets better. So at some point, we do need to weigh this out onto the balance sheet of the United States. This past bill was not the time to do that. We needed to get money into the system fast, into individuals' hands fast, small business owners fast, and into the general marketplace. So our larger employers and our bank systems and our credit unions all had the liquidity and the credit to be able to move forward. Because as we've hit the pause button here, we were coming out of an extremely healthy, robust economy, and it's this voluntary shutdown by government that is causing this economic upheaval. I want to make sure that we've got the tools in place so when we reemerge, that we're able to go right back to that economy that we had. It's going to be a little different, we know that, but certainly I think we've got the ability to build on those fundamentals of a solid economy, which we had just a month ago.
The fight against the coronavirus is not just about money. Sometimes, even if you have the cash, the things you need to buy just aren't available at any price. such as the problem for things like ventilators and personal protection equipment. When we come back, we'll have that conversation with the state's senior senator, Sen Stabenow. That's next. To the Point. Welcome back to the Point. The fight against coronavirus goes from Washington to Lansing to your community, right down to your street. And even if you have enough money, like that $2 trillion stimulus package to buy the things you need, can't always find ventilators or masks. And the problem goes further than that. That was pointed out by U.S. Senator Sen Stabenow. We talked with her earlier this week, and I asked how she was coping with the coronavirus from her home in East Lansing.
Well, first of all, I'm at home in Lansing. Hello, I know you're at home, and to everyone in West Michigan, I know how tough this is. And for me right now, I came home at the end of last week when we passed the CARES Act. I am literally at home like everyone else, not going out right now, doing my part, but I'm burning up the phones every day. I spend the majority of my time every day, 7 days a week, on the phone with the governor, with the members of our delegation, with FEMA, with Health and Human Services, with private manufacturers in Michigan, trying to get as much medical equipment and protective gear for our nurses and doctors who are on the front lines and everyone else who are essential workers right now. And, you know, Rick, when we get done, we're going to have a whole new group of folks that we define as American heroes, from the folks keeping the grocery stores open to people delivering the mail to the National Guard who are now out helping with our food banks and delivery trucks and everyone that's needing to remain employed. But my day every day is spent trying to figure out how we can get as many resources to them to protect them, as well as deal with this healthcare crisis as quickly as possible.
You talked about the emergency bill that was passed, $2 trillion worth of aid for individuals, businesses, big and small. Tell me a little bit about that package and how that came about, because the negotiations, while they went on for a while, it happened pretty quickly.
Well, it happened within about 5 days. I was on the ground with the first group of folks that negotiated this in the Senate, and there were two goals in my mind. One, we have to focus on the healthcare needs. This is a pandemic. If we don't get our arms around this and deal with the virus, this is going to go on and on economically and hurt more and more people and businesses. So major investment in our hospitals and other healthcare providers. Secondly, is how do we keep income coming in to individuals, families, businesses while this is going on, so that we can get through this and come out of it and continue to move forward. And so there are a number of things that we've done. You know about the $1,200 per person, $500 for a child under the age of 17, that will be coming in various forms through the IRS as quickly as possible. I have more information on my website about that. It's to all individuals, by the way, including seniors on Social Security. Second thing is extending unemployment insurance and making sure it's not only extended a total of 39 weeks, but that more people, the folks in that are in contract work, the self-employed, a furloughed worker, the gig economy, more people, we cover everyone who is in a situation where they need unemployment. And then finally, focusing on our businesses. And, you know, there's a major effort that's very important in this bill for small business. And the focus is on keeping people on the payroll. And so, for instance, and the SBA, local lenders are involved in all of this. You can get details. But for instance, if a small business can keep their workers on the payroll the next 8 weeks, the cost of that, as well as all their overhead, would be written off of a loan. So if they get a loan, the first 8 weeks of their costs and keeping people on the payroll will essentially be paid by the federal government. And that approach is used with medium as well as large businesses. This is about helping people survive what's happening right now and focus on getting critically needed income into people's pockets.
Well, that's amazingly important, because some of the guesses and some of the forecasts about what the economy goes through, what it does and could look like at the end of this are pretty dire out there, which brings me to my next question. I mean, this is one of the biggest bills that I've ever seen move out of Washington, and there are a lot of different facets to it. But already I hear some of your colleagues talking about the fact that this was just the first part and that there may have to be more in the way of stimulus as we move forward. What's your thought about how well this will deal with the economy, short and long term?
Well, Rick, this is the biggest I've been involved with, and I've been involved in negotiating a lot of different pieces of legislation, as you know, over my tenure in the Senate. I want to make sure that this is happening quickly and that we're evaluating what we've already done to help for small business, medium manufacturers, large critical industries, individuals. You know, we've got to make sure that all this, first of all, is happening, which we just passed, and I'm very focused on making that happen as quickly as possible. But I do think we have to be open to something further happening depending on how long this goes. So we have to evaluate it. We have to see how effective what we've already done is, and that's very important. But we're in a situation where people are being asked basically to stay home, step away from their employment, close their business, do things, extraordinary things, and that for the benefit of all of us, that to tackle a virus, to stop the spread, people are basically asked to forego income, to close their business. We have to make sure that we are focused on supporting those entities. They're helping all of us. We've got to make sure that, if at all possible, that they survive and that they thrive at the end of all of this.
My thanks to Senator Stabenow, Congressman Huizenga, and Governor Whitmer for trying to bring the very latest information to you about the fight against the coronavirus. I'll be back with a final thought next. To the point. Another week at working at home for many of us, and as we start to adapt, we learn new things about how we can do our jobs from where we live. For example, this week, with the help of my 11-year-old son, I learned how to use green screen technology at home so it looks a little bit more like the studio. We'll continue to stay in touch with your legislators in Washington and Lansing to give you the very latest on their response to the coronavirus every Sunday morning at 10 o'clock on Wood TV 8 for To the Point.